Very much, Tracy. So as Tracy said, I'm going to talk about embedding implementation science principles in health research, discovery to adoption. So very often we tag implementation onto the very end of our projects. So my talk today is about maybe changing people's minds into understanding that actually you're better off having it in from the very, very beginning. So let me start with what is implementation science. But before I actually get into it, when I'm asked to do these presentations, and I've done a lot in the very recent past on implementation science specifically, I find it very difficult to pitch because I'm usually speaking to a group of quite experienced or very experienced individuals. But when it comes to implementation science, we're talking about the whole scope. We're talking about people who have only heard of the term quite recently. We're talking about people who've already dipped their toes into it. And we have people who are building to expertise in implementation science. So hopefully, there is something in this for everybody. But as you'll see as we go on, implementation science is simultaneously a new and an old science. So people are coming to it from very different places at the moment in Ireland. So what is implementation science? Well, it is about making it happen, quite simply. We're all very familiar with diffusion. So that is when we spend a year or two writing an academic paper, we put it out and it gets published in a great journal, we're delighted, and then we go, job done, I'm an academic, no more for me. But we do know, and we have learned well, I would think, in more recent years that that's not enough. And even if we look back to any of our grant applications, a good chunk at the end of it is how are you going to disseminate this work? So that's dissemination, and that's helping it to happen. So it's getting the information out there. And we're getting quite good at that. Where we haven't stepped across into as of yet, and by that I'm talking on the whole, there are absolutely centres of excellence around implementation science in the country, individuals working in the area, just phenomenal work in that area. But as a whole, we haven't stepped over into making it happen. So to go a bit further into what is implementation science. So to look at it, we need to look at the implementation gap. And there's a definition for this. It's the difference between the evidence of what works in theory and what is delivered in practice. The best definition that I can find for implementation science is methods to promote the systematic uptake of research findings and other evidence-informed practices into routine practice to improve the quality and effectiveness of services. But that's a mouthful. So what is it really? It's about identifying enablers and barriers. So enablers, that could be public involvement, accountability frameworks. The barriers are things like external environment, resistance to change, vested interests. It's studying how change is adopted, and it's really fundamentally about why something works and how it works, and capturing that. Many people will be familiar with the term knowledge translation. Knowledge translation is a type of implementation science. It's part of it, but it isn't everything. And that's about translating the evidence into practice, which is what we're doing on a day-to-day basis in implementation science. But implementation science is broader than just knowledge translation. It's methods and approaches and evidence to inform how to upscale something, how to replicate something. It answers questions on sustainability and fidelity. It does cross into other areas like stakeholder engagement, public involvement, co-design, but none of those on their own are implementation science. Implementation science is much larger. There's a life cycle to it. And it's fundamentally about bringing research to life. So I want to step back for a second into what I call a very brief history of implementation science. Because as I said before, it's both a new and an old science. So it could be argued that it began in about 1943. It probably didn't, but this is the first academic paper that I can find that actually makes reference to two key concepts that fundamentally underpin implementation science. And this paper was about diffusion of seed corn in 2 Iowa communities. And the two things that they identified as being vitally important were that individuals were the locus of decisions, and that adoption is a key dependent variable. So they are two things that we still use here and now in implementation science. They come out time and time again in the work. If we move into the 1960s, so it was widely assumed that if research was more readily available, implementation of best practice would automatically happen. And we can see coming out of that, we had a move to open access papers, and people starting to disseminate their work in formats that were different to the academic paper. If we move then into the 1970s to about 2020, we had 50 years of evolution and expansion of implementation science. We had the development of about 170 theories, models, and frameworks. And the traditional top-down approach to implementation was supplanted with multifaceted approaches involving the practitioners on the ground. So we went from top-down to bottom-up, essentially, or at least an appetite to do so. In 2021, there was a paper published by Barr et al., and they summarize what is happening in this field, and I think they captured it very well. They called it the coming of age of implementation science. So 2021 is not that long ago. And you see here in 2025, as Tracy mentioned, so we just launched CircUL, the Centre for Implementation Research at UL, and it's the first academically led, multidisciplinary, which is key, I'll come back to that, implementation research centre in Ireland. And I will come back and speak briefly at the end about CircUL. So moving on, what is the need for implementation science? Well, there's a commonly used statistic, which is research-based practices currently take about 17 years to reach clinical use, and that's an NIH statistic. If we look back further into the case of scurvy and sailors, it took 95 years between the identification of the need for vitamin C to prevent scurvy and for wide-scale adoption of providing sailors with citrus fruits. 95 years. That's because they depended on diffusion. Another stat that you'd often hear in this field is that fewer than 50% of clinical innovations ever make it into general usage. And that's because they don't have the implementation support or framework supporting them. The next use and need for implementation science is about wicked problems. So wicked problems, these are the ones that are very difficult to describe, to define. There is no right or wrong answer. There's only better or worse. Implementation science is very adept at dealing with these. It loves the fuzziness, which I trained as an epidemiologist. I hated the fuzziness, and it took me a long time to come around to actually know we can work in the area of fuzziness. Implementation science also brings sustainability and equity to solutions. So one of the fundamental tenets of implementation science is it's about doing work that benefits everyone everywhere, not just implementing an intervention for a discrete group of people. Now, what are the challenges? Well, many challenges. So you've seen in the history, implementation science has been building, lots of frameworks coming out, and now we're at a time where it's all starting to come together, and you've got all these new organizations and centers, and there's a big push. But there are enormous challenges as well. First, there's the different terminology across disciplines. So if you talk to somebody in the business environment, they talk about change management, and then you move into the health, and they talk about theories of change. They're talking about the same thing. So we do have this as a challenge, where people are talking about the same thing, they don't know they're talking about the same thing. We also have a lack of understanding of the scope of implementation science. That's challenging in that people think they're doing implementation science because they're doing co-design, or they're doing, they might have built a logic model. But unless we're embracing the entirety of the the scope of implementation science, we're not really getting to grips with it. We're not really seeing the benefit of the use of it. We have another challenge, and I consider it a little challenge, but not a great one. Many people are coming to implementation science later in their careers. They happen upon it. It's what happened to me. I trained as a public health epidemiologist. Then I started working the sugar sweetened beverage tax when I was in Cambridge. I'm trying to count back how long that is now. No, definitely over 10 years anyway. And I started to do work that was implementation science, but I didn't know it was. And it wasn't until I bumped into somebody after I moved to Manchester that I realized that what I was doing fit in this world. And once I started to embrace it, then the doors opened in terms of learning all different models and theories and frameworks and the utility of them. But we have that happens to many, many people, particularly in Ireland. And we can come to some of the reasons for that in a moment. We have limited expert knowledge in Ireland, and some of it is because we've come to it later in our careers. I'm not saying there's no expert knowledge. There absolutely is expert knowledge, but it's not in the same vein that we have in other disciplines. There are over 170 theories, models, and frameworks, yet we still mostly default to the ones that we're comfortable with. So we'd see this over and over again. People will say, oh, that framework there, that model, so to name some, normalization process theory. We'll use that for this. That works well, I know it, we'll use it. That's not a good approach. We need to actually look to all the models and choose one that is defendable and is the right fit for the work we're doing. The problem is there's 170 and there's next to no way to go to those 170 and distill them all down without knowing all 170, yet because we don't have experts in the field yet and everyone's kind of moving into the area, nobody knows all 170. So it seems like an impossible task, and we need to do some work in that, in developing methods to help people select the right tools, methods and frameworks for their work. That leads me to another thing, and this is possibly a personal bugbear. When people use implementation models, frameworks, and theories in their work in academic papers, we're not seeing the defense for the decision or for the choice for that. We're not seeing that in the academic papers yet. And it's becoming a growing problem because it's feeding into the previous problem where people are continuously relying on the models that they know. And the last one, the last challenge, as I see it, is that implementation in science is often put on as an afterthought or at the tail end of a project. And we really need to move away to that, towards embedding into the entirety of a project. So why do we need to embed from discovery to adoption? Well, it avoids implementation of an intervention or policy that isn't evidence-informed. It avoids innovation for the sake of innovation. And I've said this a few times recently, and sometimes I can't believe it's coming out of my mouth, that innovation is wonderful. But this is where implementation science really comes into its own. If there is a solution, an evidence-based solution elsewhere that we can bring across and use, if we marry it with implementation science, we can do the contextualization of the problem using the theories, models, and frameworks, and we can do adaptation of the proven solution. So if we marry the two, we can get more quickly to a solution that has lower risk attached to it, because innovation has risk attached to it. We reduce costs, and we reduce the risk of failure. So a successfully implemented policy, program, or intervention does not equal success for patients, even though we think it might. There's a word of caution in that. If what you're implementing isn't in itself evidence-based, evidence-informed, and you do fabulous implementation, that does not mean that you'll get to success, which means that the implementation science needs to come in at the very, very beginning. So how do we embed? Now, I could give a 1 hour, 2 hour, 3 hour lecture on how do we embed, but instead I will just give you the very, very top line of it and send you away to Google it. So a little bit of homework. So what we call it is Embedded Implementation Research, EIR. And there are 4 central or core features to it. And they are central involvement of program policy decision makers in the research cycle. So it's partnering with the people that are going to be impacted or going to use this or that are planning this, so that you're designing something with them. So yes, that's co-design, but you're in at the very beginning. And it's more than co-design. It's also identifying the desired outcomes. It's identifying the implementation strategy. It's developing out a theory of change with them. It's collaborative research partnerships. So it's staying involved in the process with the policymaker, with the department who has a nice new intervention, staying involved with them as research partners. It's positioning research within program processes. So that's the continuous interlinkage throughout the process. And it's undertaking research focused on implementation. So very often we go, okay, we have a problem, let's look at the problem, let's come up with a solution. We're not doing implementation focused research at that point. We do it afterwards. It needs to come back to the beginning. There are a lot of similarities to PPIE in that it's working with, not for. And when I was thinking about this talk today in particular, I think back to a talk I was at also at this conference a few years ago on PPIE and the need to embed it not just in that section in your grant application that says what are you going to do about PPIE, but actually throughout the entire project. There are a huge amount of similarities between that and implementation science. I think we are now at a point for implementation science that we were at for PPIE maybe 6-7 years ago. So I just want to move on very briefly in the last few minutes that I have to talk to you about CirQL. And don't worry, I won't bore you with in-depth knowledge of it. So CirQL is the Centre for Implementation Research at University of Limerick. It was launched last week. But it has not only been in existence for a week. I'm in post since September, and there were 2 precursors to the centre long established within the university. So HIST, which is Health Implementation Science and Technology, and REP, which is the Research Evidence into Policy and Practice. So HIST has been completely subsumed by the centre, and REP stays on as a programme, like a sister programme. We're funded by the HEA for the first 3 years, so we have core funding. And unlike other funding, we have funding to do things that will develop the centre and take on prioritise research projects without having preordained the projects. They have now been decided, but the decisions came in the ethos of implementation science. The decisions, the proposals for the research work actually came from the policymakers themselves as things that they prioritized in the here and now. It is multidisciplinary and, in a way, topic agnostic. So instead of implementation science for health specifically, which that's actually quite well ahead of some of the other disciplines, we bring all the implementation science knowledge to whatever the topic is. And we partner then with the subject matter experts in that area. So we work at the interface, or kind of the gap, the implementation gap between policy and human services. So we'll work in any area that starts with policy and ends in human services. And the centre is configured with core staff at the centre. So we have 6 staff. And then the outer group are the programme monitoring group and the advisory board. So the programme monitoring group are other academics within UL that have expertise in implementation science, but they work in their own disciplines. So we have people from health, we have people from environment, we have people from business, criminology, etc. And the advisory board then are an external group of international and national individuals with considerable expertise in implementation science. Outside that, then we have our membership. So membership at the moment is constrained or restricted to UL staff, but it is opening up next week for others as well, outside of the university. The core objectives are to encourage uptake of evidence-informed policy and practice in areas identified as problematic by government departments, state agencies, and voluntary sector partners. So that's what I was alluding to there when I said the research questions undertaken by the centre aren't decided by the research centre as they're decided by the actual policymakers. The strategic aims then are to develop implementation research capability and support implementation methodologies to encourage the uptake of evidence-informed policy and programs. I feel like I'm always saying that. Anyway, pardon me. The second strategic aim is to be a trusted advisor with expertise in developing strategies to support implementation, so a port of call for policymakers and for practitioners. And the third strategic aim is to build capacity in implementation science nationally and internationally through teaching and contributions to the academic literature. So our current work, we have 3 big projects at the moment and a number of small projects, but just to give you a flavour of what is happening. We're working with Respond, one of the leading approved housing bodies, to evaluate the implementation of the Respond approach. So the Respond approach is about building communities, not just housing. We are working with the Department of Children, Equality, Disability and Integration Youths, I know that is about to change, to look at the implementation of the local childhood poverty action plans. So there's 4 pilot plans happening at the moment. We're also working very closely with Limerick City and County Council, and this comes back to what I've been saying about the need to work with the policymakers. So from the get-go, we have been working hand in hand with the Mayor of Limerick and he has been prioritising different areas for us to undertake work with them on. So the biggest one we're doing at the moment is on the expert group on homelessness and linked drug addiction and their action plan around that. So unlike the first 2, where we're doing more so evaluation of implementation, in this we're actually doing co-production and facilitation. There's a lot of facilitation, workshop facilitation that happens in this field as well. We're also, under our strategic aims, we're developing training courses, and they're aimed at researchers and practitioners. So not only do we want to increase the capacity and knowledge of implementation science across the country in researchers, we also want to upskill practitioners. So we're talking about civil servants and local authority workers and policymakers. The future of the centre then, so there are great plans. We want to elevate the knowledge of implementation science across Ireland to mastery level. We want to develop accredited 3rd level training in implementation science, so we plans started on that. There is no 3rd level training, accredited 3rd level training. You can't do a postgraduate diploma in implementation science anywhere in the world. You can do kind of small courses and do a 10-credit module, but you can't actually do a diploma or a master's, a taught master's anyway. We want to grow through development of membership, but also sister centres and hubs. So we're already in the process of developing a sister centre in Queen's University, and hopefully we get that off the ground. I suppose there's a little bit of an altruistic aim in this. We want to elevate implementation science across the country and not just within UL, within the centre. The biggest challenge we have at the moment is the need is rapidly outstripping the resources. We're at a point in implementation science where people have started to hear about it. If you go to many of the policies, like government policies or strategic documents at national level, there's always a section in it on implementation. There's a sentence on the need to implement. So it's out there. People know that we need to do it, but how we do it, those 2 dots haven't been joined up quite yet. As I said, implementation science is old and new. It's sort of, and I'm going to borrow from Ernest Hemingway here, it sort of happened gradually and then suddenly. And we're in the suddenly right now. But in Ireland, we definitely have a gap between the capacity, the skill set, the knowledge base for implementation science, and the need and the ask for it. So we need to work, and I am speaking to the grant holders here and academics, we need to work in that area to embed it into all our work across all our disciplines so that we can do that catch up and meet that need, because it's real and it's here and now. Thank you.